Good evening, everyone, and welcome to today's monthly webinar. This is the series of monthly webinars and will take place on every fourth Sunday of the month, and it's dedicated to the mental health, well-being, and the art of living happily through mindfulness, science, meditation, physiotherapy, psychology, counselling, stress and stress management. We invite teachers and professionals and scholars to broaden our understanding on those subjects and share their experiential knowledge. The Letchworth Dhamma Nikethanaya Buddhist Academy is a registered charity and dedicated to promote the mental health and the well-being of the community. They're a large part in their community and they're very visible. So a warm welcome to this monthly seminar, and it is hosted, as I said, by the Letchworth Dhamma Nikethanaya Buddhist Academy, a mindfulness centre for education, meditation, physiotherapy and counselling. And if you'd like to be a part of this, then please reach out and send in through your details through emails or telephone and to become part of it. It's also hosted in collaboration with other organisations such as the Milton Keynes Vihara Mindfulness Centre, the Bedford Mindfulness Meditation Community, and the Godmanchester Centre for Complementary Health, Mindfulness and Meditation Community. There's a range of services which they offer to help with your health and well-being, and there are 2 courses which I've done both of and I can fully recommend. It's recommended that you could come and experience those 2. There's an advanced one and a beginner's one. And these both start on the week commencing on the Thursday, the 4th of March for 8 weeks. And then on the advanced one is on the Wednesday for 8 weeks. Starts at 7 p.m. Until 9 p.m. The details are all on the website. And there's lots of information on there, so I recommend that you go and have a look. But before we start, I'd like to remind you of the few ground rules. They would like you very much to keep your video on and understand if you don't feel if you feel uncomfortable about this, but please do, and keep your mics muted. But you can always unmic the mute to have a chat. And there's question and answer sessions, and you can use the chat box to post your questions. But please allow the speaker to deliver his session. And please enjoy your session. So without further ado, I'd like to welcome our guest speaker today, who's going to talk about positive psychology, mindfulness, meditation, and the art of staying present through difficult times. So on behalf of Bhante Akurula Samathia, excuse my tongue doesn't roll over these words so well, and the Letchworth Dhamma Buddhist Academy of Mindfulness Meditation, Milton Keynes, Bedford and Godmanchester Mindfulness Community. I'm very grateful to Dr. Kamal Witharana for accepting our invitation this evening to present the webinar, so thank you. But let me first introduce him by reading his short profile. So Dr. Kamal Witharana was born a Buddhist in Sri Lanka, with experience in teaching Buddhism at a government monastic school while he was working as a medical doctor and the regional director of the health services dealing with curative medicine, preventative medicine, as well as conducting health education programs across the country. He started to practice meditation in his childhood with the influence of his father. As a doctor of medicine and a postgraduate doctor of public health, he has been working since 2008 in the UK. He's a qualified clinical and public health lecturer too. And in the UK, his volunteer work includes conducting mindfulness meditation across England, conducting a Dhamma school for children, delivering talks, and conducting Dhamma and meditation discussions across England for various Buddhist centres, and conducting speeches and engaging discussions for Satori online group. He also helps people with ADHD, conducting mindfulness meditation to minimise stress and anxiety. He delivered his first international Dharma speech and presentation with excellent feedback on the request of Reverend Baswama from the Dharma Centre of Colchester, in the memory of the Most Venerable Denmark Dinapa Mathuro. Being an associate member of the Positive Psychology Guild and Network UK, he conducted a qualitative correlation research to establish the relationship between mindfulness practice and the behaviour and attitudes of health and social care staff towards their clients with challenging behaviour, which showed evidence that regular mindfulness practice could make a real difference to reduce anxiety and stress of the staff while providing care to their clients in challenging issues. So please, Dr. Kamal, thank you very much for your time.
Yeah, good evening. Thank you very much, Emma, and with great respect to Bhante Samhita, because he been very generous to share his Dhamma teaching and Buddha's teaching with you all, and inviting me to be a part of this meditation academy, Letchworth. So I know the time is already 13 past. So let's start. But I did not expect from you just to give such a long introduction about me. So, but thank you very much, Emma and Bhante. So what we're going to do tonight, so talk about positive psychology and mindfulness and facing difficult situations through mindfulness. So if you see my aims and objectives, really my aim going to be how to use positive psychology and mindfulness from positive psychology aspect and Buddhist psychology to face difficult situations. So that's the aim. So you have question time. I'm happy we got today Dr. Thora, Bhante and Dr. Thora and Sue Hart. So they may also be engaging in answering questions so we can have a good interactive session. So then the objective is going to be, to fix this session, I'm going to use certain tools. So what are the tools? Are we happy? What is positive psychology and why it is important? Spectrum of psychology, distinction between psychology, psychiatry and positive psychology, states of mind, 3 dimensions of life, and Polyana Principle is a very important one. Prema Model, Buddhist psychology, mindfulness and positive psychology, brief practical session and question and answer session and take home message. So please be aware. I've been having a very busy weekend because we had a full moon day on Friday. So I was conducting yesterday Dhamma school, and today again a retreat and discussions, meditation. So therefore, in case if you feel my sounds a bit funny, I really apologize for that. Now, so what is psychological state, first of all? So psychological state could be, sometimes we may have unhappy mind. So I started with unhappy mind and happy mind. It means worldly happiness and ultimate happiness. If you have any questions later, I could answer them. But unhappy mind, happy mind, or indifferent mind, or otherwise neutral mind. So these are the 3 states of mind anybody may have. Now, what makes us not happy then? So we always try to be happy. So what makes us not happy? Just forget about the birth for a minute. So we're not happy when we aging, when we becoming old, when we become sick, ill, COVID or whatever, we're not happy. We not like to face death, or otherwise when people dying and encountering the unpleasant situations. So people and separation from the pleasant people and situations and not gaining what one desires, and very deep sense, all five aggregates are, in short, make us not happy. If we get time, we could talk in details later. So these are the things which may cause us not happy. So then how this unhappiness manifests? How do we know, are we happy or not? If we quickly go through this slide, so unhappy mind, which we call toxic mind. So we may be pessimistic, irresponsibility and self-pity, angry, blaming, jealousy, worry, anxious, stress, depressed. So it means if we got a couple of these signs, yeah, so it means these are the signs of toxic or unhappy mind. And then what about manifestation of happiness then? We may have courage, justice, honesty, compassion, kindness, generosity, tranquility, integrity, equanimity, wisdom. So then we all can judge now. Are we happy? Really, if we are happy, or are we not happy? So by judging whether we got these any of these unhappy signs or happy signs. But from Buddhist psychology point of view, so normally if we can just briefly say, so virtuous mind got qualities of generosity, loving kindness and wisdom, whereas toxic mind, the greed, hatred and delusion. I'm not going in details because I heard attending Dr. Thora's session at this meditation center. So he'd been talking in details and Bhante been talking in details and a doctor a month before he was talking in details. So therefore, let's try not to repeat. So then what's the health means? Because we're talking about mental state. So according to WHO, health is a state, not just you have no diseases. So it's complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So then we need to think now, by looking at this definition, are we really happy? Are we really healthy? So then to do that, what we could do, we could put our mental health onto a spectrum. So what's the spectrum? On our far left side, we can put sick people. It means mentally ill people, maybe schizophrenic, depressed, stress, bulimia, or any other mental health. So we think in the middle are healthy people. So are we really healthy mentally? So it means, are we really mentally and socially, we got well-being, and not only just we are not sick. So we need to think about that. But for last decade, the scientists, doctors, and they've all been looking at the left side of this spectrum. So they're doing researches, they're treating, they may be treating with medication, people who sick, who ill with mental health issues, and maybe cognitive behavior therapy and different type of therapies and talking therapy and counseling. So, but they never thought about there is another side of this spectrum. So are we thriving and prospering? So it means the left side, they put people who mentally ill, and in the middle, they thought we all are healthy because we have no mental health issues. But that's not the case. Only within last decade, Dr. Seligman and some other people started to think about the right side of the spectrum. So which is the far right? Are we thriving and prospering? Can we think about what can we do to build on these people's strength? So whether we can help to reach their goals rather than just treating depression, stress, and other or bipolar disorder or whatever the mental health issues. So then let's see what psychology and psychiatry. So what did they do and what are they doing? I mean, a couple of decades before, they couldn't treat any psychiatric illnesses, but now nearly about 14 illnesses could be treated. But the rest of the things, they are just doing counseling. I'm not just denying psychiatry and psychology. Of course, they are really good. So asking what is wrong with you and make people less miserable. So they ask what's wrong with you. But we forgot to ask what is right with you. Can we build on your strength what you can do? And can we help you to reach your goals? But instead, we're trying to treat them of for their maybe their hallucinations, delusions, challenging behavior. So this is traditional psychology. I don't like to call it negative psychology, but that is traditional psychology is focused on the sick end of the spectrum. So they are good at diagnosing and treating, and psychology is about the past and future. So why do I say that? So person had some bad experience from the past. So had a bad experience in the past. So he or she is thinking about that experience now. He is trying to build his future on the recollection of his past memories. So then he never tried to live in the present moment, always thinking about the past and thinking about what I am going to do in the future and what could happen to me in the future because I am anxious or I am depressed. So, what could you do in the future by knowing the past? And we are constructing possible futures and evaluating them, having memory about the past, but not focusing on the state of in the present moment. So then, ladies and gentlemen, with great respect to Bhante, so where are we going to have a time to be present then? So we're thinking about the past. So this happened to me, maybe some trauma, maybe family breakdown, financial issues, or maybe people died of COVID virus. As we said, we had to be, disassociation from loved ones or association with unloved ones. So we're thinking about the past. And then we think what going to happen to me in the future because I lost my parents. So I was not treated well by my employer. So those kind of any recollection of past memories and thinking about the past. Okay then, so what can we do for the people on the other end of the spectrum is classed as positive psychology because this end has been ignored till last decade. So positive psychology, if I give some definitions, is focusing on the other end of the spectrum, which is the right side one, which we saw the spectrum, the scientific study of what makes life most worth living, and intentional choice to see what is positive. When we're talking on Polyana's principle, you may be able to understand that maybe you're already aware of that. See the life the way truly it is, upside and downside, and not getting sucked into the delusion such as pain is bad. So when we have a pain, we just label it and say pain is bad. But pain is not equal to bad. Pain is equal to pain. So that's why we need to take pain non-judgmentally, which we're going to talk in details later. So positive psychology put you in a position to see accurately and clearly see the world the way it is without delusion. So we're not labeling, we're not being judgmental. We see the things the way they are, but not the way we want them to be. Taking more higher and intentional control over our mental processes, especially evaluation, judgment, creation, ability to move forward. So instead of just giving antipsychotic treatment to a person who is stressed or depressed. So why, of course, the medication is not everything. Of course, we can give medication, we should give medication, but why can't we try to help the person to build up on his abilities, strength, but not just looking at the weaknesses. So focusing on people's strength, but not on weaknesses, and building the good instead of repairing the bad. So we always try to repair the bad, then we taking person again to the past and asking, okay, please tell me what happened to you, what's wrong with you, who did that to you, can you recall your memory, so can you recall what's happened to you. So therefore, positive psychology, ladies and gentlemen, an intentional choice to see what is positive and see the life truly. It's both upside and downside. So we know now the difference. Maybe we are recapping, refreshing your knowledge if you've been already knew this. Okay, then what is not positive psychology? Sometimes we think unrealistically happy and giddy and positive all the time, or just pretending to be happy, or denying pain and negativity. When there is an unhappy moment, we just deny it. We just try to look at the other side. Otherwise, unrealistically be happy, positive, or just pretending. So that is not positive psychology. So you could ask questions later on because it's a very long topic. Depending on the time we got, we need to go through. So there are 3 dimensions of happiness, according to Martin Seligman and Positive Psychology Association USA: the pleasant life, engaged life, and meaningful life. So I'm going to cover these things during our question and answer session, because as I said, I'm not going to use all the tools on my objective box for the presentation, but whenever you ask me questions, I may have to come back and get these tools, because I want to cover most important stuff, which is how to face difficult situations. Okay, so I'm just moving. And then there's a thing called Prema Model. So it means positive emotions, this acronym, engagement, positive relationships, and meaningful life, and accomplishment and achievement. So there are certain exercises, happy exercises, engagement exercises, relationship exercises on positive psychology. Let's see the time. Okay. Right. So what are the interventions on positive psychology we could do? So we can do mindfulness exercises, gratitude visits. When you have questions, I'm going to go through. Strengths Day and fun via philanthropy. So these are some exercises we are using, but my presentation today based on mainly on mindfulness. Okay. So now if we take research evidence, according to researchers Tember and Penwell, there are many ways this positive bias manifests. People overestimating the size of valued object, avoiding looking at unpleasant pictures, communicating good news more frequently.
Excuse me, doctor.
Yeah.
Did you
Yes.
stop the slideshow, or you want to
No.
just talk yourself? Yeah.
No. I haven't. So you can't see it?
No, we can't see it. Sorry.
Thanks very much, Bante, if you told me. No, I haven't stopped. Please check whether I could see now.
Now that is fine. Yeah.
Okay. How many slides like? So
We just seen
how long it's been?
the last one was about the furthermore, further up, further up, further up, furthermore. Furthermore, furthermore,
Really?
yeah, that was the last one we saw.
Okay. So what did we say if I quickly go through?
Yeah.
So the psychology being, and
You have time, don't worry about it. We have time about 45 minutes more.
all right, okay then, good. Because what did we say so far? The sick side of the spectrum being looked at and treating people, diagnosing people, doing researches. But it's been ignored to see the thriving and prospering side of the spectrum because we thought healthy means we have no diseases. So that's why we didn't want to look at the positive side or the right side of this spectrum. Okay, if it again goes, please let me know kindly, Bante. So then I said the psychiatry and psychology, asking what is wrong with you or making people's life less miserable. And traditional psychologists focus on the sick end of the spectrum. They are good at diagnosing and treating, but we never thought what can we do to build on these people's strength. And psychology is about the past and future, which I explained to you. And again, we're going to do a practical session to see that, not as a concept, to reflect on it. So what could you do in the future by knowing the past? So as I explained, people, especially with mental health issues, maybe they faced tsunami or Second World War, a terrorist attack, or otherwise COVID-19, death or lost. So then we're thinking about the past and living in the past and thinking about what could happen in the future. So we are constructing possible futures and evaluating them, having memory about the past. So what on mindfulness, what we try to do, not forget the past. So we just realize past is gone and future hasn't come yet. So therefore, let us make the future right now and here. So we don't focus on the state of in the present moment. So then what I was saying, positive psychology focus on the other end of the spectrum. Positive psychology put you in a position to see accurately and clearly see the world the way it is without delusions. So I'll explain you later what we mean by delusion. But if I give a simple example, when we have a pain, we try to equal the pain to bad. But pain is equal to pain. So that's the reality. If you just give another experience to your physical pain, then you're going to have a second experience, psychological experience, then pain going to be double. So again, the real definition of positive psychology, intentional choice to see the what is positive and see the life truly. It's both upside and downside. Not only listening to good news, not only looking at good stuff, beautiful stuff, and ignoring, denying the negative ones, ugly ones, or the ones you don't like. So then what is not positive psychology? Unrealistically happy and giddy, positive all the time, or just pretending to be happy, or denying pain and negativity. So when we have a pain, we just try to forget the pain and start thinking about something. But we don't try to understand the pain is pain. So you're trying to label it, try to be judgmental and give another psychological experience to that primary pain. So then finally you have primary pain and secondary pain. Okay, so 3 dimensions, we can come to that when we do the question time and Prema model as well. So then let me talk about on my own research. So a couple of years before, so there was a care agency due to GDPR. I'm not allowed to tell what was it. So I did this research and gave, if you could see that on Positive Psychology website, if you go to PPT network, so that organization, there were carers and nurses looking after clients with autism, Asperger's syndrome, and learning disabilities. So one day, accidentally, it was a coincidence, one lady carer, one lady nurse came to my meditation in one of the temples in London. So then she was doing meditation. She said first, do you know, Dr. Kamal, I came for the meditation because really I have a big problem. I'm working in a place where I can't cope with people's challenging behavior because they got different mental health issues, learning disability. Then I asked, okay, then what's the problem now? She said, most of our workers not coming to work. They're just reporting sick, absent, and they are under stress due to challenging behavior. So therefore, I came to do meditation. I heard it helps. Okay, I said, fine. So then let us talk about what are the positives, what are the negatives. She was saying, okay, very good wages, working hours, flexible, no peer pressure, caring management, constructive feedback, they always give us, and then potential to be promoted, uniform and other facilities given. I'm just briefing. And there is a phone to carry, bonus scheme, advanced training. I also did challenging behavior training 3 years in a row for that company. Then there are 10 positives. I asked, okay, what are the negatives? People not coming to work, but they don't say they have no job satisfaction, but they are stressed due to challenging behavior of service users. I said, come on, let us use Polyana Principle of Buddhist psychology. We're going to talk in a minute. So let me tell a fake name. Okay, Edna. So you got 10 positives, whereas you got 2 negatives. So are you trying to leave this job because of 2 negatives? She said, yes, about to, but now I'm not going to leave. But some of our staff planning to leave and find a different job. I said, do you think that different job may not have this situation? She said, no guarantee. I said, okay, if you like, speak to your manager and get informed consent and let us start mindfulness meditation. Okay, then it's a long story. So we started through mindfulness meditation. Then I asked them, why you not happy? Because whenever I try to give care, so it's the clients becoming challenging. Then I asked, why is that? She said, because they are very rude. They are very, very challenging because they just don't like us. Not because our skin color or anything else, they are to everyone, no matter what's the skin color, what the ethnicity, but they behave in challenging way. But sometimes when their family comes to see them, they are okay. I said, okay, do you think that is attributed or that is this challenging behavior belongs to them? If challenging behavior belongs to them, they should be treating even family and friends the same way as they treat you. Okay, then I ask, are their behavior same to their management? Not either. Whenever manager comes, they are happy. That's fine. So they're talking nicely. I said, okay, then what we need to try to do, change the perception, change the way you think towards whenever you're providing care to these people. So the problem was accept as a reality, but to deny. I mean, this challenging behavior could be due to their judgment and perception. So let us try to change the perception towards them. Then you will be okay. So then we started to conduct 6-week mindfulness meditation. So they've been okay after 6 weeks. Of course, couple of people, they dropped from the session. So it was not right meditation for them. And then we did different type of mindfulness meditation for the clients and families as well. And we took a control group. Then finally, after 6 months time, they managed to improve their absenteeism, 12%. So people started to come to work, yeah. So not being absent like before, and job satisfaction. So they are not scared to approach these people with challenging behavior. By changing, we haven't changed the staff, we haven't changed the management, we haven't changed the client, but we managed to change the people's attitude towards these people. So how did we do that? Let us go through Buddhist psychology. Whenever we have wrong view and wrong intention and wrong thoughts, then our behavior going to be not that good, because we always judge. So they started to say, this man, this Tony, just a fake name, always when I reach him, he started to tell me off or just to hit me. Okay, then I asked, okay, let's try to change the approach. Why do you just prejudice? So you already labeled him as a challenging person. Instead of changing your own behavior, your wrong view, your wrong intention, wrong thoughts, because you always think this man is challenging because he got autism. And then you have wrong intention. You're always going to him, you get, just say, he may hit you or she may hit you. And you always have wrong thoughts because you just prejudice and you stereotype and you say, these people with autism and Asperger's and learning disability are always challenging. So let us try to change it. So that's what we did. Now, before we move into the Buddhist psychology, let us see who we are. So we are the body and mind. So if I say, who is Kamal? It's body and mind. Who is Padma? Body and mind. Who is Emma? Body and mind. So then how do we experience the world? We have through 6 senses: eye, ear, nose, tongue, body, and intellect. So in Pali canon, there is a discourse called Chapan Sutta. So Buddha took 6 animals from different ranges and habitats, such as snake, crocodile, bird. This is an example, Buddha's simile, dog, monkey, and hyena. So what they did was they took a long rope, yeah. So they bind with a strong rope and tying a knot in the middle and would chase to them. So now snake trying to go to the anthill, crocodile is trying to go to water, bird is to air, dog to village, so on. So you will see how this similar going to fix to our own body and sensations. So same as that, guys, respecting Bhante. So eye is pleasing our forms. Our ears are trying to please our sounds. Nose trying to please our aromas. Tongue is trying to please our flavors. Body is trying to please our tactile sensations. And intellect pleasing our ideas. So if we take that simile, so like those 6 animals all the time, so we are trying to be attracted to one of the forms, sounds, flavors, smells, tactile sensations, pleasing ideas. So then what's wrong with that? You may ask me, so what's wrong with that? Now, okay, what do you think? Whenever you see this baby, what sort of sensation you have? Can any one of you tell me, please, if you wouldn't mind? What's the sensation you have now?
Smiling, happy.
So are you happy by looking
Looking,
at this baby?
yes, because his face looks happy. He looks
Very good.
content, innocent.
Well done. What about this one? So someone is trying to shoot the driver, maybe a robber or a terrorist. So what sort of sensation or feeling you have? Another person, please, if you wouldn't mind. So it already says anger or worry, isn't it? So here we may have attachment towards this baby, and here anger or worry. So this one is pulling towards us, this one is pushing away from us. And these are the worms in the gut, may be very disgusting, pushing away from our mind, yeah? So which we don't like. So whenever we see this one, maybe neutral, just a bridge. So whenever we contact these things using our senses, so either we have pleasant feeling, unpleasant feeling, or neutral feeling. But whenever this baby was seen by the nurse in Manchester, she had unpleasant feeling. She started to kill 10 babies using insulin injection. Okay, because she had unpleasant feeling, but we are having pleasant feeling. And maybe another robber may be like this. So he may have pleasant feeling. And maybe someone may like worms. So depending on the person, we may have either pleasant feeling, unpleasant feeling, or neutral feeling. So the other thing is when we heard these phrases, thousands died of COVID-19, vaccination is reducing the number of cases, social distancing is preventing cross-contamination, cost of living is rocketing up. 600 further COVID-related deaths have been reported. Oh, I am fed up of you, daughter, get lost. I had enough with you, take your cup of tea away. How many times should I tell you? I really don't know. I wish you were not my son anymore. So either we see things, either we heard things. So what are we doing then? When we see or when we heard, we started to have perception. So it means pleasant, unpleasant, or indifferent sensation makes us perception, which is a conceptual dimension, recognize and identify an experience. Okay, so my dad or my mom told me off. Otherwise, I saw terrorist attack. So it was nothing to do with us, but we try to make perceptions. If you just saw it, you just go away with it, but not thinking about it. Otherwise, whenever you saw this baby, so why should we carry this baby in our mind to our house? Yes, I saw a nice baby. So then we try to put many adjectives: cute baby, beautiful baby, nice baby, white baby, small baby. Then finally, these adjectives make you to think, which we call perception. So then what's wrong with perception? So when you have perception, then you have mental formation, which is not a conceptual dimension, but moral dimension. So it means the conditions response to the object of experience. If it was to do with baby, you try to hold the baby, or you try to talk to the baby. Otherwise, the nurse is trying to kill the baby. Or otherwise, if it was with the robber, so you may try to attack him, or you may try to just do something about it, or you may call 999. Yeah, that is a good thing, of course. But then we carrying this experience in our mind to our house. So like we said, we are living in the past, we are living in the future, because we carrying all sort of things to our house. And then we are thinking, we telling our wife, do you know what I seen today? Or otherwise to partner, husband, to children. So then we living in these thoughts because we had a pleasant feeling or unpleasant feeling. So then we created a perception, being judgmental. Then we had mental formation. Then we're going to be conscious. Yeah. More awareness or sensitivity to an object, which is the ego consciousness. So there you think, okay, Kamal, I saw the baby. So I can't just say there was a baby, it's not seen by me. So we try to put that on us, which we call self. So if we can be non-self, and if we can think these feelings and sensations come into our mind and they disappear. So if we know that these thoughts, emotions come into our mind and they disappear straight away, we don't have to stick onto them. We don't have to cling onto them. We don't have to push them away. Okay, then we're going to do a small mindfulness exercise now and see how can we change our perception? How can we change the relationship with external sources we getting information from. Okay, so what I'm going to ask you now, so please gently close your eyes. Please gently close your eyes. Okay, now we're going to small imaginary exercise. So just pretend you have been carrying 2 suitcases from the past in your both hands. So just pretend you have been carrying 2 suitcases in your both hands. So on the one suitcase, it's written PAST, past. On the other one, FUTURE, future. So in the past suitcase, you have recollection of many, many memories. And in the future suitcase, you have future worries, future plans, future anxieties. Please carry them. It hurts your hands. Your hands hurt, your shoulders ache. So please pretend that you are carrying these 2 suitcases, very heavy. Please feel the heaviness. Please feel the heaviness. Very heavy suitcases. Very heavy. Just pretend. Feel the heaviness of these suitcases. Yeah, I feel very heavy. I've been carrying them long time and came to the Zoom's place. Now please lower down the left-handed suitcase very slowly, lower down please, lower down. And once it's touched the floor, just uncurl your fingers and get your left hand relaxed. So feel how light is your left hand is. So we put our past, all the memories away. We let go. It's no more troubling us. Feel your left hand is relaxed. Okay, let us take the other one. Okay, lower down your right-sided suitcase. Slowly, because it's too heavy. Let it reach the floor. Oh my God, uncurl your fingers. I got rid of that as well. Still your eyes closed. Now you are in the middle of the past and the future. Middle of the past and future. Now stay present, past gone, future is not there anymore. Bring your attention to your tip of the nose. With no judgment, keeping your attention at your nose, start noticing any feelings or sensations you may have from your body. They may be pleasant ones, unpleasant ones, or indifferent ones. Now move your attention from your nose to the place you are feeling the sensation from. Maybe your feet. So if that sensation is from unpleasant feeling is coming from your feet, just bring your attention to your feet and connect with your mind with no judgment whatsoever. Just do that for 1 minute. Connect your feet with your mind. You are a scan machine, not a judge. Observe the feeling. Observe the sensation. Like a scan machine in the hospital, you are an observer, not a judge. Now, if you have any feeling from anywhere else, move your attention to that place, maybe at your knee joints, and notice, observe, be aware of your knee joints and the feelings. Do not judge. Any thoughts come into your mind, just let them go like clouds passing by the sky. So just imagine your mind is the sky, thoughts and emotions, let them go. They are impermanent, they appear and disappear. So then you don't have to stick to them. You don't have to push them away. Bring your attention to your feelings and sensations with no judgment whatsoever. Do not judge, just notice like a scan machine. Now gently open your eyes, please. due to time factor, we're going to discontinue that meditation and just try to integrate that to our daily life. Please look at the baby now. Can you indifferently see the baby with no judgment, no adjectives, no adverbs? Just see the baby as baby. No judgment. Whenever you're going in the town, you don't see always beautiful parks, beautiful flowers. You may see many negative stuff. So let's try to build on what we can see positively and see the things as they are, not the way we want them to be. Same thing with worms. So what we did, what we expected, whenever you see anything, you heard anything, you sense anything, you smell anything, try to be non-judgmental. So we're going to quickly go through the Polyana Principle, which is very, very important one. So what is Polyana Principle? Okay. Okay, Polyana Principle means there was a girl, 11 years old. So if you saw this Disney movie or if you read the book on Polyana, so when Polyana was 11 years old, she was orphaned because her father died. So then she been shipped across the country on trains and she was orphaned and in orphanage. So she had to live surrounded by grumpy people. So but Polyana never chose to get in an orphanage at the age of 11, and she never chose to get shipped across the country on trains. She never chose to be surrounded by people who are grumpy. However, Polyana was taught by her dad, who was a minister before he died, a game called Glad Game. So what's the Glad Game means? So he taught her, whenever you may encounter different circumstances, situations in the life, but don't try to think about negatives. Try to see what you can find to be glad about. So that was the Glad Game. So it was taught by his dad, first taking toys. Then after that, he started to be non-judgmental and see the things as they are, but not the way she wanted them to be. So it means, but she was not unrealistically happy and giddy. So she started to think and see the things as they are, as they were, not making any judgment. So changing her relationship towards people and towards situations. So this is called Polyana Principle. So if you also can be a Polyana, or sometimes they call this Polyanish. So it means try to build on our strength and what we can, whether we can reach a target or goal, but not denying or avoiding the negativities, but see the things as they are, but not the way we want them to be. Example, we get angry with our friends. Why? Because we think friends have to behave the way we want, or husband, dad, mom, wife. We want them to behave the way we want, but they are different people. So why can't we see them as who they are, or not the way how we want them to be? And the situations also. So why can't we see the things, people, situations as they are truly, really, rather than trying to make them the way we want them to be. So that is the message I want you to take home. And this meditation also, we should not keep it on our cushion or in the chair. So we need to see the world as they are, as really they are, and not to judge, not to make unnecessary perceptions, be non-judgmental, and always think these feelings, sensations, thoughts, emotions, they just come and go. So if they come and go, they are impermanent. But if they come and go, can we control them? No, we can't. Then it's non-self. So sometimes when they don't stay the way we want, feelings, sensations, emotions, it makes us unhappy. So these three characteristics are fundamental characteristics of the nature: impermanent, non-self, unsatisfactory, which was told by Buddha 2650 years ago, which been researched at Harvard University in neuroscience, psychology, positive psychology, and found they are very useful. So thank you very much. So this is question and answer time. Because positive psychology itself is a very long, deep science. It's difficult to explain during this short period of time. So please be free to ask questions. Or I don't know whether we're taking a break. We ask from Bante.
Thank you very much, Dr. Kamal Witharana, for taking the time and all your personal experiences to share your knowledge and experiences very generously for our community, for the welfare of all our community. Thank you everyone for participating. Please unmute yourself if you wish to ask any questions, or please put those questions onto the chat box. We have very limited time. So make sure that you are giving the questions and also giving the opportunity for all of us to participate. Very interesting talk, lot to take away and very well done. So I'm very pleased that I organize it for all of us. Thank you again, and a lot of blessing for Dr. Kamal Witharana for giving us this opportunity to talk about positive psychology, mindfulness meditation, and how we can stay present, strong, non-judgmentally, and very meaningfully, especially at difficult times. So over to you. Please take the opportunity and to ask any questions.
Hi, Dr. Kamal. Could I just have a quick question? I wanted to ask you what your experience is when you are trying to sort out in your mind the desire aspect of pleasant, unpleasant, and neutral feelings. How do you identify what is desire-free and desireful when you perhaps are thinking about something that is hard to identify? How would you go about that?
Okay, my good question. I mean, we can't live without desire. So it means to be positive, even to have positive psychology, we should have desire. But the problem is not the desire itself, it's the craving, attachment. For example, whenever I saw a baby, of course, if you are a natural, normal person, so we have a pleasant feeling. But the thing is, if we're going to pursue that feeling, I mean, if we try to think about the baby or unpleasant feeling, and I try to think about the way that the nurse thought in Manchester, and then either to kill or to hold or to get like my own possession. So the thing is, desire is fine, even to for the most of everything we need to have a desire, but we should not have attachment and pushing away. So what happened was, example, Emma, I could tell you a story now. I think 2002, we had tsunami disaster in Sri Lanka. So 30,000 people died over the period of 20 minutes, including my aunt who was on the train. But that time, I don't want to lie. So my meditation was not that improved to see the things neutrally. So of course I was crying. So in spite of, I did a lot of postmortems. So I saw people who died. Still, I could not accept the fact. But when I started to mindfulness meditation, then I could change the way I think and the relationship of my mind towards external stimuli, situations, and people. So therefore, I told you, I'm a person who had a stroke. I could not talk. I could not walk. So it was 2018, 18th July, July 18th. So then physiotherapist came to me and said, I was trying to walk onto the doors, the walls, because I don't know where I was going. Then I said to the physiotherapist, don't worry, I'm going to start practicing mindfulness, which helps me to be mindful all the time whenever I do something. So we help me now. God bless, touch wood. So I'm okay now. So this is the best example experience I can give on me, not anyone else. And then my own research. Yeah.
Thank you.
Yeah, 1 second, please. Well-being in our community, please feel free to make a donation. Sorry. No, I think no questions. You could put on the chat box if you have any questions, if you don't want to be verbal. But it should come, Emma, through meditation. I mean, you can't overnight change it and tomorrow say, I'm going to see the world differently. Because what Buddha said was, you have two worlds. One is the external world, internal world. So what is the internal world? Eye world, nose world, taste world, ear world, mind world, and the body world. So we can change our inner world, but not the outer world. That's what Buddha said. 5 aggregates are causing suffering. So what are the 5 aggregates? Forms, what we see, what we hear, what we smell, etc. And then the feelings, which I have pleasurable, pleasant, unpleasant, or indifferent. And then the perception. So I'm going to perceive that situation or object. Then I'm going to have mental formation. Just say someone told me off in the street. So then what I'm going to think, number one, I'm going to have mental formation in the mind. Okay, why did he say that to me? Who is that? So then in mind, then you have mental formation. But then you lost your temper, then you started to tell him off also. Yeah. So who you are. So why did you say that? Now we have, using the verbal, the speech wise, then we're going to have another mental formation. Then, but you lost temper, you're going to attack him. And he also attacking you. Then you have mental formation due to your body. So we have mental formation due to the mind, due to the speech, and due to the bodily actions. Then we carry all these things home, which is we call consciousness. Then we telling to wife, today what happened to me. And then whenever you see him again, it comes to you like a planted seed. Yeah. So that's what happened. Okay, can you explain please in more details how you use mindfulness to recover from the stroke? Okay, so it means I, as a doctor and as I seen people with the stroke, my mom also had this stroke. So then I knew what a stroke is going to do. Stroke is stop you eating and drinking. Stroke is stop you walking. Then stroke is stop you talking. Then I thought I have no stroke. Be positive. Yeah, so I have no stroke. So then I thought what I can do rather than thinking not what I cannot do. So I am okay with my left. Even to be honest, I forgot now which side I was paralyzed. I believe it was left. Yeah, it was left. So then I thought, okay, left side is not working, but right side is working. So Polyana Principle. Yeah. So why can't I build on the strength instead of thinking about weaknesses? So I thought I'm going to do exercises with my right hand, left hand. Yeah. So then whenever I am walking, I am going to be mindful. So Buddha said, Gacchanto agacchami. So whenever you're walking, you know you are walking. Whenever you're sitting, you know you are sitting. Whenever you're standing, you aware you are standing. When I am walking towards the door, if I know where I am, which way I am walking, I'm not going to walk onto the wall. Instead of I am walking through the door. So like that, I practice mindfulness of the body, feelings, sensations. And whenever I had the thought, I am paralyzed, I saw it in my mind through meditation that thought comes and goes. So when I notice not as a concept, ideally reflecting on my thoughts, then I was not attaching to that. I just let it go like birds flying to the sky. I thought my sky is my thought, clouds are emotions and thoughts, so let them pass by. So I'm not going to attach to them. I'm not going to push them away. So step by step, I was getting okay. Physiotherapists invited me to come and do a meditation session for their physiotherapists in Norwich. They said, really fantastic. We couldn't say that you could recover couple of, it was 6 weeks. In 6 weeks, I could walk. So like that. When you told the story about the 6 animals all going to different places, was the main learning that our feelings and perception can pull us in different directions. I like yeah. Okay, this metaphor, Joe, to be honest, I told on the part of the metaphor due to time factor. And Buddha was saying, so now these 6 animals, one is trying to go to water, one is to air, but our senses always, only one is prominent, one is taking lead. Example, you are trying to work on these all 6 senses, but one sensor is taking the lead. You can't at the same time, you can't see a thing, you can hear a thing, you can, but your consciousness is on one thing. So then Buddha said, whichever the animal, whoever the animal is stronger, that animal is pulling the other 5. Yeah. So therefore always one is taking the lead. Example, I am watching telly. So someone is passing by in front of me. I saw it, but I didn't notice it because I'm concentrating on teledrama. So otherwise, someone is asking me something. Have you put the heaters off? Sometimes wife first I say, yes, I did. But you didn't because you're concentrating on this one. So that's the metaphor. Okay, is thinking positive coming from place of judgment? You can't think positive when it is negative. That is not positive psychology. When it is negative, it is negative. Example, now just say there was a beautiful thing, there was an ugly thing. But we always try to look at the beautiful thing instead of looking at the ugly thing. We always try to get the good news rather than the bad news. So thinking positive means see the things, like I said, as they are. Bad is bad, good is good. Pain is pain, but pain is not bad. But if you're going to put a label onto the pain and say pain is bad, then I am going to give a signal to my nerve system, so prefrontal cortex and amygdala, saying pain is bad. So then my amygdala started to think, okay, pain is bad, pain is bad. Now I have another pain. You have secondary experience of feeling now. So we don't want to act like Thora said the other week. We are trying to put another feeling, another experience to our primary experience. Okay, how do we learn to be mindful through meditation and apply to daily life? Is it through initially establishing mindfulness of breath and then increasing one's concentration? I mean, Buddha said only the way we can find the truth, reach the ultimate truth, is being mindful of four framework, four establishment. Number one, mindfulness of body, mindfulness of feelings, mindfulness of thoughts, and mindfulness of mental object. But we can start from being mindful of feelings or breath. But breath being taken by Buddha as a body, because sensation, you are feeling whenever your air is going in and out, but that also comes under anapanasati, or otherwise the establishment of first foundation, which is the body. But again, you can feel, but the problem, the thing is, Samantha, is not that we are mindful of our breath. So we need to see, not as a concept in our mind, look, inhale is change into exhale is change into inhale, sometimes it's longer breath, sometimes shorter breath, which is not under my control. So whenever I wanted it to be under my control, I am not happy. So you need to see in the mindfulness meditation, these three characters not as a concept, but reflect on you, within you. So then you know, okay, if feeling, sensation, thoughts, and emotions are impermanent, what is the point I am clinging to them? What is the point I am pushing them away? Okay, someone told me, Kamal, you are stupid. Okay, fine. So then I take it just as a word, like someone told me I am stupid in Chinese language. So I don't understand Chinese, but as I did understand the word in English, I take it granted. So then I'm going to have unpleasant feeling towards that word. Then I'm going to take it. Then I'm going to react. So we use in the Newton's third law. Each reaction has the equal reaction opposite to the other side. Yeah. So therefore, if we be mindful, take it this word as a word, because I don't want to make it more religious, what Buddha said to Bahir. So he said, once you heard something, take it, I just heard. I saw something, take it as seen. If I thought something, take it as thought or sense. Just a sense. But what we trying to do, we trying to put another experience onto that and thinking, okay, why did he say I am stupid? So maybe he's stupid. So just see this come and go. So whatever he said, whatever you thought about it, just appear and disappear, rising and ceasing. So that is the Buddhism all about. So Buddhism is the science of beyond the mind. So if someone sees thoughts, emotions, feelings come and go, then we should not attach to them. That is the mindfulness all about. Otherwise, if you do till we die, just mindful of our breathing, feeling, sensation, we never reach the target. But only thing is we can relax our mind, which we call tranquilizing meditation. So we need to go into the insight meditation and see how impermanent they are. Then we can say we done proper meditation. Any other questions, please? Or you could add anything. Please don't make me just a speaker. You also can add your experience, your expertise. I know Bantes, they don't want maybe to add, but anybody else you like to share your experience? Yeah, think about little Polyana. So she was 11 years old, but she was not she did not choose to where he is living, but he got choose to be glad about something which is good for her. But she didn't think about the negative part of this life, because otherwise she could have never succeeded. She knows father died, so I'm 11 years. If I'm going to just think about the negativities, I won't have a life. So that's the glad game. If you could watch that movie or read the book, lovely.
Dr. Witharana, I have a
Yeah,
question.
yes, doctor. Yeah.
When you do mindful actions, you won't have negative feelings and emotions, but should you also actively have positive emotion like compassion? Should you
Yeah,
do?
yeah, Dr. Sri, like we said, we have toxic mind and virtuous mind. So even the other day we had the discussion. So what we trying to do now, just say you are an angry person. You always get angry. So then Buddha recommended loving kindness meditation is good for that person. However, this loving kindness would not last long if you do not practice mindfulness. Because in order to, loving kindness is not something you keep in your pocket and say, okay, come on, I love you, I'm kind to you. But it should come from our mind. For example, this morning meditation, one lady from Sri Lanka, she was saying, though I practice loving kindness meditation, it won't come exactly in my mind. So then I said, you need to improve not only loving kindness, but especially the equanimity. So loving kindness, compassion, sympathetic joy, empathetic joy, and equanimity. So you need to train your mind to see the things the way they are, as they are. And for example, if someone is spending a luxury life, so I'm not pointing out, Dr. Sri, you, this is a general example, yeah? So luxury life, but I'm not going to be jealous, because I think that is maybe his karma, or otherwise he succeeded his life through his own effort. Otherwise, if someone is very poor, having very poor life, but yes, we should have sympathy and empathy. So we can think, yes, it could be karma, or otherwise he didn't have any effort. So we have balanced view, equanimity. And then we need to be mindful. And if your mind has the qualities like greed, aversion, and delusion, then we need to try to move into generosity, loving kindness, and wisdom. Then remember, maybe you may have a question what delusion means. Not you, sometimes you may have a question, but you didn't ask. I said, saying pain is bad is a delusion. Because we had put a label onto that pain, and we categorize pain is bad. So that is not the right view, right intention, right thought. That's Buddha said, ayoniso manasikara. It means you didn't have right view, you didn't have right thought, you didn't have right intention. So you put another label and said, yes, pain is always bad. Yeah. So otherwise, being greedy is always good. Getting things which I want, always good. So who knows, anytime you may lose it. So then you clinging to it. So once you lost it, then it causes you suffering. Yeah, Dr. Sri? Because according to the Harvard research, in our life, we lost in thoughts nearly 45%. So nearly half in our life, we lost in thought. We are not living in the present, always living in the past, otherwise planning the future. So that's why cortisol level is going up, which causes stress, and chronic stress causes depression. And whenever you stay in the present moment, so we can absorb more cosmic energy. So cosmic energy is the life force. So cosmic energy is controlling our metabolism in our body. So therefore, whenever you deep sleep, but that's different, we are not consciously silent, but whenever we mindful, so we consciously silent, and then we can get more cosmic energy, which regulate our metabolic functions. That is the other benefit of mindfulness. That's why Buddha said, go outside, sunyagara gatova, rukkamula gatova. Better to meditate outside, according to the researchers, but in the 21st century, we won't find a forest or under a tree to meditate. So they're saying we can get more cosmic energy while you meditate outside. If we'll unmute me, ask question of Janba. Okay, in Buddhism, does mindfulness have to be always be accompanied by clear comprehension and wise attention, not being? Yeah, in Buddhism, there are three things. Atapi sampajano satima vinayaloke. It means you need to have effort, you need to have knowledge, then you need to have the concentration. Yes, not just be aware, you need to use the right knowledge, atapi sampajano satima, and then knowledge, and you need to make an effort. Sometimes people think making effort means to do the meditation. No, not to do the meditation, but to effort to get rid of dukkha domanas. It means abhinya domanas. Buddha said abhinya domanas. Abhinya means greediness to other people's stuff. And then domanas means, the one is pulling towards you, the other one is pushing from you. So Buddha said, be in the middle. Don't try to push the things away from you. Don't try to pull the things towards you. In terms of mind. So that's what Buddha said, which is called Majjhima Pratipada, middle way. So you have to be in the middle way, but we have to use Atapi Sampajano Satima. It means the effort. And of course, right concentration. Yeah, these things. It says comprehension, wise attention. Yeah. So wise attention means the Samma Ditti. You mean that's what difficult to explain, which is the way you see the things as they are. Buddha called in Pali Yatha Bhuta Jnane. So we see the things as they are, but not the way we want them to be. Does it make sense? I mean, we need to go through 8 noble fold path, starting from right view, right intention, right thoughts, right speech, and yeah. So there are 8, which is the path, because the 4 noble truths says, not the life is suffering, truth of life suffering, and then truth of origin of suffering, truth of cessation of suffering, and truth of path to cease the suffering, which is the middle way.
Thank you, Doctor. That really clarifies my question.
Okay.
Thank you.
All right. Thank you. Again, please don't think just for no reason we trying to be positive. That's not the positive psychology. Not unrealistically, because even Buddhism, some people think optimistic, some people think pessimistic, but neither. Buddhism is realistic. So realistic quality we are using in positive psychology in Polyana Principle as well. So don't try to be optimistic too much. Don't try to be pessimistic either. Be realistic. And see, this is what's happening. When someone got COVID, yeah, there is a chance to die. So if you don't want it to happen, so prevention is better than cure. So let us do social distancing. Let us get vaccinated. So life is that. Dr. Thora, would you like to add anything to us, please? About positive psychology or anything you think useful?
I just thought that what you were saying about that lady was asking about the different aspects of mindfulness, and you were saying that the definition of mindfulness is different atapi sapanjano, satama, vinaya loka, bija dormanasanam, and that bija dormanasanam aspect of letting go of competitiveness or pushing away against the world. I thought that kind of reflected on the Jhana Sutta, the Jhana Sutta with the six senses, and how one sense is either pulling towards something or pushing away. And then so the animals are tied together by the string going through the forest. But if the animals are tied not together, but to the post and pillar of mindfulness, then then the senses, the animals come near the post and pillar, everything settles down.
Yeah.
So I think one way that you could stop this push and pull is actually mindfulness, and maybe mindfulness of the body. That's what I was thinking.
Yeah, absolutely. Yeah. I mean, Buddha, the Sariputta, the Arahat Sariputta gave another example about fetters. Because people think when I look at a beautiful object, so my eyes is pulling that towards me. Otherwise, object is pulling my eyes towards that. But Sariputta Thero said, not the object is pulling, not the eye is pulling, but there is a fetter. So Sariputta Thero gave a good example, you take white cow and black cow and binding them two end of the string. So the white cow is pushing the black cow towards her, and vice versa. But if you cut the string in the rope in the middle, so they are independent. So it means the problem is not with the eye, problem is not with the cow, the beautiful stuff, but the fetter. So the fetter we have in between, Buddha said sangyojana. So therefore we need to try to get rid of this fetter, the attachment, but we can't change the world again. So someone asked this morning, if girl is not wearing properly, so she causes raga, attachment, greedy on me. So is she responsible for that? Of course not. That is their rights. So they can wear the way you want. So, but the thing is, so you need to get rid of the fetter, because in one of the sutras, Buddha said, how you have to be mindful. Buddha said, there is a nice, very beautiful lady, a dancer, is dancing this part of India. So you have to go, I mean, a big crowd is watching her, admiring her. So then think that you are carrying a big barrel of or pot with oil, full of oil. So you have to go in between this dancing pace, because it meant you to look at this woman because she is very beautiful, and someone is coming behind you holding a sword. If you drop any oil from this pot, I'll cut your head. So that's what Buddha's example, that is the way we need to be mindful. Then you need to be mindful the way you're walking, where you're going. You need to be mindful to keep the pot on your head, not dropping any drop. Yeah. And then you need to be mindful, not listen to the music. And you need to be mindful to not look at such a beautiful woman. So most beautiful woman in that area, in that city is dancing. So very rare she comes to dance. So anybody may, even a woman, so may even just try to admire her and see her. So this is the mindfulness. So it's not that easy to be mindful. It's not just about closing eyes and watching your breath. So like the question says, yes, awareness, comprehension, wise attention. Yeah, they all should come together. Any other contributions or questions, please? I mean, I expected many questions. That's why I did drive 90 miles per hour, my session. So I thought better I should give more time you to ask questions and for contributions. So rather than just talking. So please take this opportunity. You could ask questions from Bhante, you could ask two Bhantes, Dr. Thora. I don't want to talk about Dr. Thora's experience in terms of many things. He may have not told you, so you could ask questions. Okay, now then if you have no questions, let me try to do something now in terms of mindfulness. This is more practical thing. This picture here. Yeah, okay. Now, can you see a picture, Dr. Thora? Yeah. Can you see on the screen? Yeah.
Yes, I can see. Yeah.
Yeah. Okay. Can we not closing eyes? Yeah. Just pay attention on this man's head, top of the head, with no judgment at all. Don't look at the tree. Don't look at the sunshine. Don't look at the clouds. Don't look at the grass. Just pay your attention on top of the head with no judgment. Don't think about what we were talking. Don't think about what's going to happen next. Don't pay attention on rest of the stuff. Just pay your attention on the top of the head and stay 1 minute, please. You can do self-assessment and see how mindful we can be. Yeah, this is kind of self-assessment. Whenever you've done your meditation, now, according to the Harvard research, if you practice mindfulness meditation at least 15 minutes a day for 28 days, you become a totally different person. So I had one person, he been practicing about 6 years meditation, mindfulness. So one day I asked him, how did it work? He said, Kamal, last week when I was meditating, doing walking meditation, my cat came behind me, so I killed her. You see, so he been practicing meditation, mindfulness 6 years. So but he couldn't tolerate it. So he had unpleasant feeling. So he made perception. So he killed the cat. So what sort of mindfulness is this? I didn't say anything. So because that's not the time to explain that to him, because he was just recalling that memory. But unfortunately, he died of COVID-19 in his 60s. So therefore, whenever we do practice, that's what I like to call this outcome-based mindfulness rather than evidence-based. So what are the evidence? We can say, I've been practicing meditation with someone that much. Every day I do practice meditation. I am mindful. But why don't we check ourselves, just do a self-assessment? Whenever your wife or husband shouted at you, could you be mindful with no judgment? So that is the way we need to do that. I think for another session, Dr. Thora was making a timetable and see, so how improving us through mindfulness. Otherwise, there is no point. We giving evidence and say, oh, I do everyday mindfulness. I have on my phone how many hours I did. So we need to find what have we got. So which I did through my research. I'm not just boasting because it is my hobby to do research on meditation. But finally absenteeism and everything became okay by 12%. So people started to see differently and clients started to see, because I couldn't make clients to do meditation like we do. What I did was I put a blue dot on the wall and I asked them, okay, look at this drop, this spot, blue spot, how long you could be. So then first day could not do at all. Then first day 2 minutes. Then after that 3 minutes. So like that they improved. And then for the family also I did the meditation, but I never said this is to do with Buddhism. So as I said, Buddhism is science of beyond the mind. I think in Tibetan they call science of mind. So it could be even beyond the mind, because Buddha talked about consciousness, which he called vijnana. So therefore, please try to find something that you could make a self-assessment and see how improved we have been. Because now, for example, even if I die tomorrow, I am okay because I had a stroke. So now I am okay with stroke, but very, very rarely I get fatigue. So therefore, if you have assurance that I feel okay, and I try. I mean, I am not saying I'm perfectly purified my mind. Of course not, but I try to be. So try to be also is good. There are 8 groups in Buddhist, the Sangha community, 8 groups. So the first group is you are just trying to reach the Sowan or the first stream. Yeah. So therefore, at least we could be on the way. Yeah. Attapurisa Pukkala.
Hi, Dr. Kamal. What was what was looking at the person's head? How would you assess if you could hold your attention on it? Is that the assessment?
Sorry,
check.
kindly, Emma, could you repeat that? This alarm was disturbing me. Say it again, please. Yeah, please call
It's
me
no problem.
Kamal. Yeah,
Hi,
really.
Kamal.
Yeah.
Yeah, just about the little exercise you said about the self-assessment. So
Yeah.
if you can look at that and just focus on the head and do that for a minute, that's a good outcome. What was the outcome of doing that exercise?
No, that's the thing. So that's the evidence, Emma. That's the evidence because I did it. But we want the outcome. Now, for example, first day you could pay attention 1 minute with not letting your mind to distract. And
Okay.
second day you could do 2 minutes. But third day you couldn't do at all. Fine. Yeah. But again, like that, you could, like, you know, whenever we jogging, there is a app in here. Yeah. So you can just say, but that app says how many calories, how many, what is the distance. But we have an app on mobile phone for the meditation, but it shows how many hours you did meditation. But where is the outcome? So now outcome of mindfulness meditation, we can lower our blood pressure, lower our pulse rate, cortisol level is going down, and we can get rid of physical suffering, mental suffering, lamentation, and then finally there are 7. So finally realize the ultimate truth. So we need to think, okay, I've been meditating. So what have I got? Yeah. So example, we work, and at the end of the month we get wages. So we're happy. So this is the outcome. But evidence is you worked, but you did get nothing. So therefore we need to focus on outcome rather than what we've been doing or how many we did, how long we did. So the outcome is the most important thing. Because there was some monk, famous monk called Portila, Buddha's time. So Portila knew Pali canon, even in his previous life, couple of lives, by heart. If you ask anything from Dhamma, so he can say from anywhere. So, but he couldn't even be mindful. So Buddha said he's like the empty box. Yeah. So said, go and practice. I mean, I didn't ask you to just to know my teaching by heart. No one is going to benefit from that. So the most important thing is be mindful. Whenever Buddha passed away, his last word also, appamadena sampadeta. It means do not delay, not to do, he didn't mean to do good things. He mean be mindful, not to be delay, to be mindful. Person who is not mindful, facing continuous death. Continuous death means not physical death. It's something to do with death of mind. But person who is mindful, not dying, because he is always living. See, because you're living now. So, but if you're not mindful, you die because you lived about yesterday. Again, you try to live about tomorrow. So you have no way to live. So you're dying all the time. But if you're mindful, every time you live till your physical death, natural death.
Thank you. I think it's hard for me to imagine somebody meditating and not directly experiencing the benefits, because then why would they do it? You know, they must, as they go through, feel better. They I can't see how you couldn't, even if you're doing
but
it.
Emma, would you agree with me now? For example, not meditation, anything we do, if we can't reach the benefit, if we can't get the benefit, do you think is there any use? But only thing is, now there is a thing called tranquilizing meditation and insight meditation. But whenever you do meditation without doing insightfully, you can relax your mind. But Buddha did not want Buddha wanted us to accomplish not only tranquilizing, not only samatha, but the vidarsana or insight meditation. So benefits purification from all kinds of defilements, such as greed, delusion, uh, hatred, and then, overcoming sorrow and worry, overcoming lamentation, all kinds of physical and mental suffering, and realizing ultimate truth. So we need to see at least we could get these things, or whether my blood pressure down, whether my pulse rate down, whether my blood sugar is down. That did not said by Buddha, but Harvard University research shows. I think Bante.
Thank you.
Yes, Dr. Kamal, thank you so much for that excellent contribution. We all benefited immensely. And
I don't think Bante benefited, but yeah.
No, that's very true. Very true. We all benefited enormously, and thank you so much for taking the time.
Because if I compare with you, Bante, I'm a very little person in this aspect.
Yes, thank you. That's how it should be, to develop the humbleness, develop this equanimity. That is where people really grow, that you can see yourself when you are going further and further, you become a very humble person. So that shows us how much the teaching has changed you. So I could take it as an outcome of a meditation.
Thank you. Yeah.
So thank you everyone for taking part of this meditation and engaging yourself very attentively. Next month, we have this ongoing seminar every month, the fourth Sunday. The next one is being done by Dr. Steve Taylor, bestseller, author of Waking from Sleep, Out of the Darkness. So he will be talking about spiritual awakening through psychological turmoil. So I would invite you all to take part into that as well. Also, we have meditation sessions, courses that you can take part. And thank you very much for all your support to keep us available at a very needy time for the community that need of this type of teachings, to make us all very supported to develop our well-being and happiness. Now let us sit 1 minute to bring us together to close our program for the day. As I did not stop you all because it was really important questions and contributions from all of you. So that was very good session. So let us sit in 1 minute to finish our program for the day. Experiencing the posture, the sitting. Slowly letting the mind to come to the present. Putting aside your past and future. Developing sense of loving kindness. May I be well. May I be peaceful and happy. As I am, may all beings be well, be happy, and be peaceful. Let us bring our palms jointly together, close to our heart in gratitude. And be grateful for our speaker today, our Dhamma teacher today, Dr. Kamal Witharana, and we are very grateful for his contribution. May he find the best of health and all the courage and protection to continue his good contribution, good work, helping for the many aspects of the community. Thank you very much. May you all be well and happy. Slowly open your eyes and continue to keep yourself in the present. Even though eyes are open, don't get yourself lost in the external world or past or future. Try to find that state of calm within and kind to see things as they are, non-judgmentally, and find the joy within it. Looking forward to see you all again, to share more experience and wisdom. Until then, do stay in blessings, stay safe, stay well, all the blessings. Thank you very much. Thank you very much, everyone.
Thank you, Bente. Thank you, Dr. Kamal.
Yeah, Bante, thank you very much giving this opportunity just to be a Dhammadana. So I wish you could realize Nibbana in this same life as a result of these all Dhammadanas, Bante.
Thank you, Dr. Med. Thank you very much, Doctor. Your father especially and your parents who inspired you at the very young age to this path of Dhamma, and now you have grown up like a big tree, and the blessings and the Dhamma Dana merits be with them all and your family and everyone. May you all in the life be well and happy and benefit from all the merits you acquired today. Thank you so much.